Namaste, welcome back to our channel. My dear student, today topic about placenta previa. My dear student, before entering into the placenta previa, I would like to tell what is the meaning of placenta previa and what it indicates. So if you want to know what is the meaning of placenta previa, this is one of the complication where you can see for the antepartum hemorrhage. Let me tell what is the meaning of antepartum hemorrhage. The bleeding, the hemorrhage may occur for the woman before the delivery. As we know that before the delivery, the time duration is called as antenatal time. So during the antenatal time, in the sense after fertilizer ovum get go for implantation. So once the implantation occur, from the implantation till the delivery, the portion of time around 9 months time duration is called as antenatal time. Whereas during the antenatal time, if the mother is getting the hemorrhage, if the mother is feeling the bleeding, in such case we can call it as antepartum hemorrhage. So here I am saying here, so placenta previa is one of the biggest complication for the antepartum hemorrhage. How it will be? Let me tell what is the meaning of placenta previa. As usual, we know that so once the fertilizer will occur, later the ovum, zygote may form. So once the zygote is formed, so after that actually we know that at the fallopian tube only the fertilization and zygote may form. After that it will travel up to here and it will go and attach the endometrium where the layer of the uterus. There the anterior portion, anterior segment of the uterine may takes a place of implantation. That is actual process of the implantation as we know that. Whereas in the case of placenta previa, once the zygote is done, then it is going to formation and implantation at the lower segment of the uterine. Whereas the normal is upper segment is takes a place, whereas here in the abnormal gynecology is saying that so implantation may occur the lower segment of the uterine. You can see in the diagrammatically, so where the female reproductive system, the formation of the baby. So here this is the actual location for the implantation of the placenta. So implantation of the this one. Once the implantation occur, the baby will form. The growth and developmentation will be occur. That is as usual normal. Where you can see here, this is the lower portion of the uterine segment. So here the placenta is get implanted and from here only the nourishment supply will be occur for the baby. So this is the actual diagrammatic position. So this is abnormal implantation of the placenta for the lower segment of the uterine. That will be called as placenta previa. This is exact condition of today's session. Let us see what kind of the risk factors. So because of these risk factors, may be chance to get the woman as a placenta previa. The first one is multipara. As we know that the multipara is nothing but when the mother is getting more than 2 deliveries, more than 2 or 3 babies. In such a case, so this is may chance to get placenta previa. And increase the maternal age is absolutely when the mother is more than 35 age. So in such a case also may chance to get placenta previa. History of previous scar in the uterus. So a scar of the previous muscle of the uterus may get scarred. In maybe that is maybe chance to get. And because of smoking also, these are the few risk factors may be chance to get the placenta previa. So this is the one of the causes. Next one is the placenta previa may be different kinds of the things is divided. So here type 1, type 2, type 3, type 4. So type 1 is indicating the implantation of the placenta for the lower segment. So here it is telling the first one is a type 1. That is a lower segment the implantation will occur. Where you can see the diagrammatically the lower segment implantation will occur. And type 2 is the implantation may occur marginally. The margin of the portion may implanted. Whereas incomplete, so it is not completely closing, so it is incomplete. Whereas third one is completely it is closing the cervical thing. So this is the 4 kinds of the categories of placenta previa. So the first category, second category is undercoming of mild degree, whereas third type and fourth type will coming under major degree. So these are the two kinds of the degree of severity of the placenta previa. So here I have explained about the types and divisions of the placenta previa, and lower, I mean 4 are lower and marginal, incomplete and complete. There are the 4 kinds of the placenta previa, whereas the degree, the mild degree and major degree. So these are the 2 kinds of degree of severity of the placenta previa. So this is about the degrees and divisions, where I can see the symptoms. The absolutely one of the major symptom when the mother is facing placenta previa, the bleeding. She may get bleed. Yes. So vaginal bleeding will occur in the case of placenta previa. Absolutely. So this is the actual location where the implantation will occur. That is a normal. The nourishment of the baby, the nutrition of the baby will be normal. If the placenta is implanted at the lower portion of the segment for the uterus, in such case the bleeding may occur. The fresh blood will be bleeded. So this is one of the major symptom we can able to find, and we can see the maternal complication. In the case of this placenta previa, what kind of the complication may face the mother? Yes, absolutely. So this is the categories, 2-3 kinds of the categories we can see. The complication will occur during pregnancy, so I mean antenatal time. The complication may occur during the time of the delivery, and the complication may occur during the postnatal time also. Let us see, the first one is during the pregnancy. In the case antenatal time, what kind of the complications we can find out? The first one is antepartum hemorrhage. Absolutely, we can see the bleed will occur because of placenta previa. And mal presentation, the baby presentation will be the mal, in the sense there is a different kinds of the presentation is there. So for suppose cephalic presentation is a normal presentation for the normal labor, whereas in the case of this placenta previa, the cephalic presentation may get the breech presentation. So different kinds of the presentation will be occur. So that is one of the complications. And premature labor. So in the case of placenta previa, so before the term, so before the month of 38 and 40 weeks of the term labor, may chance to get the before the delivery, the premature separation will be occur. So that will be occur premature labor, premature baby will be delivered because of this placenta previa. So next one is during the labor. So during the internatal time, so what kind of the complications we can see? The first one is early rupture of the membrane. As I told you, so because of placenta previa, the rupture of the membrane. So the rupture of the membrane, what kind of the membrane? There is the amnion and chorion membranes are covered the baby. 2 kinds of the membranes are there. So this is the rupture will be occur early. In that case, the complication will occur. And one more chance, one more complication, cord prolapse. Yeah. So umbilical cord will be may get prolapse. And next one is slow dilatation of the cervix. So during the labor process, the cervix, cervix and uterus may get dilatation may occur thoroughly, but in the case of placenta previa, the cervix dilatation won't be occur properly. If the dilatation is won't be occur up to the centimeters, 10 centimeters or like that, so the baby delivery may get some obstructed labor. In such case, we can go for LSS, surgical procedure. And next one is intrapartum hemorrhage. Absolutely, when there is a placenta previa, then definitely the bleeding will occur within the mother womb. So this is the complication. Whereas the complications after the delivery, yes, absolutely, after the labor process also, the complication may chance to get because of placenta previa. That will be postpartum hemorrhage. Means after delivery also may chance to get the bleeding, that is called as postpartum hemorrhage. And next one is retained placenta. Yes. So retained placenta also may chance to get, and subinvolution. The uterus may get the subinvolution also. So this is the complications we can see for the puerperian time. And what are the things, complications we can see for the baby as well as for fetal. So here 3 kinds of the complications rarely we can see. The first one is low birth weight. Yes. So when there is a placenta previa, so nourishment, the supplementation of the whatever the things getting from the placenta to the baby, so may chance to get some kind of the disturbance. In such case, the baby's weight will be the low birth. And next one is asphyxia. As we know that asphyxia is nothing but the oxygen percentage of the baby is decreasing because of this placenta previa detachment will be occur. And next one is intrauterine death. This is the life threatening condition, so that is the intrauterine death. So when the pre-rupture or whatever the complications, so because of these complications there may be chance to get the baby death also within the mother womb. So that is the one of the complications, that this is the 3 rare complications for the baby within the mother womb. So these are the things. And next one is management. What kind of the management we need to do in the case of placenta previa? So this is the highlighting points. So prevention. So before get the placenta previa, if there is chance to get the prevention, you can go for the preventive measures, as well as once you find the mother is having placenta previa, go for the immediate management, expected management, active management, as well as being a nurses, we need to go for nursing management. Few kinds of the nursing interventions we can see. So continuously, if you find the mother is placenta previa, you can continuously monitor the vital signs and go for provide the rest and reposition, change the positions of the mother, as well as mostly encourage the mother take the relaxation techniques. So and mostly check the mother HB level. Yes, we know that HB is a determining the blood percentage of the mother. So that's what we need to thoroughly check the HB level for in order to serving the mother for the normal labor. So this is about the placenta previa. This is a condition belongs to abnormal gynecology. Yes, my dear student, today's session about the placenta previa. I have discussed about what is the meaning of placenta previa and what are the types and divisions and what are the degrees of severity, as well as what are the symptoms and complications and management. That's about today's session, my dear students. So for next session, I will come with new topic. Until then, stay tuned. Please like and share and subscribe. Don't forget to comment. Thank you so much.